Hello, everyone. My name is Sylvia Levy, and I'm the Communications Officer for the ANH Academy and the Imana program. Today, I'm the Technical Manager for this plenary session on agriculture, nutrition, and health in the time of COVID-19, chaired by Richard Horton. Thank you so much for taking part in ANH 2020, and welcome to day 2. We look forward to an engaging and interactive session this hour. Afterward, we'll see you at one of our 5 thematic sessions at 2:30 p.m. London time, and then at one of our social hangouts at 4 p.m., including one all about the animals and plants in our lives, and another hangout hosted by the African Nutrition Society. Don't forget to take some time during the breaks in the program today to explore our poster hall and the pre-recorded oral presentations. A quick reminder that everything you might need to access the conference materials and interactive program can be found on the ANH Academy website at anh-academy.org/ANH2020. Before Richard takes the conversation forward, I have a few technical announcements to ensure our experience is as smooth and interactive as possible. Please introduce yourselves using the chat function. Let us know your name, where you're joining us from, and the organization that you work with. You can access the chat box by clicking the chat button at the bottom of your Zoom screen. When you send messages in the chat box, be sure to click all panelists and attendees instead of all panelists. That way, your messages will reach everyone who's in this session. Later in the hour, we will open up the conversation with a Q&A session. If you have questions, we invite you to share them in the chat box throughout the session, and we'll do our best to raise them during the Q&A. If we have time, we might ask participants to raise their hands so they can ask their question using the audio function. Throughout this session and today, please get involved in the ANH 2020 conversation on social media by using the hashtag ANH 2020. Last but not least, if at any point you experience technical issues, please check your audio settings and your internet connection. You can always try to reconnect to the session using the same Zoom link. If you have a technical question, please just send me a private message using the chat box. And that's it. Thank you so much. And over to you, Richard.
Thanks very much indeed, Sylvia, and welcome to everybody from, as I see the messages coming up, truly from everybody around the world. It's tremendously exciting to see that this Zoom call is bringing us all together. And it's bringing us together around a super important issue. David Nabarro, the World Health Organization's special envoy on COVID-19, has described the times we're living in as a revolution. And we would like to explore today the nature of that revolution for the agriculture, nutrition, and health community. We've really got the most fantastic group of panelists to reflect on this, and we've got you who are also going to be firing some questions at us as the hour or so proceeds. So welcome, and let me get on straight away and introduce our panel. First, we have Gabrielle Berman, who is from the Ethics in Evidence Generation part of UNICEF. We have Khadija Mittu, who's at the University of Chittagong in Bangladesh. We have Sarah Menker, who's from Grow Intelligence, and I hope Sarah will tell us a little bit about Grow Intelligence. We have Patrick Webb, who's from Tufts University and the Global Panel on Agriculture and Food. Each of our panelists is going to speak for about 5 minutes. Then we're going to have a little discussion amongst ourselves for you to reflect upon, and then I'm going to open it up for all of you to pose your questions. So as you're hearing the presentations, please think about the most difficult questions that you can ask, and we'll go from there. So let me go straight away to Gabrielle Berman from UNICEF. Gabrielle, over to you.
Okay, fantastic. Thanks, Richard. All right, let's get this going. Okay, here we are. All right, I'm not going to be talking much. I'm the Senior Advisor for Ethics and Evidence Generation at UNICEF. So when we talk about evidence generation, we're talking about everything from research to evaluations and data collection and analysis. And so the belief is at UNICEF that ethics applies to the actual data collection analysis process, not necessarily to a particular output like research or evaluation, but it's actually we need to be thinking about the ethical issues straight through the process. So today I'm just going to talk a bit about some of the issues that has been raised at UNICEF around ethics and collecting evidence generation during COVID-19. Now this comes from a paper that I wrote helping some of our staff think through, well, what are the ethical issues and when should we or shouldn't we undertake evidence generation? So first of all, obviously one of the quick go-to areas when you're not able to go out in person is through use of big data. And perhaps it may or may not be, I suppose, relevant to some of you, but we frequently go to kind of social media and collect data there. And I think I won't go into too much detail, but just to say that we need to really think about some of the privacy considerations when we're using big data and third-party data, and thinking not only about individual privacy, but also categorical privacy. And also reflection is required, and this is very kind of critical around who is or isn't included in the data sets. And in terms of marginalisation of voices, etc., that's absolutely critical. So when you're using social media, think about who is included and who's excluded. When we talk about face-to-face during this period, obviously proceed with extreme caution. And the recommendations coming out of the paper is very much around the only time you really should be doing face-to-face data collection, particularly in the face of lockdowns, is if it's for emergency, for the provision of emergency services, and if it is absolutely critical. So we shouldn't be doing, as a general rule, face-to-face, we shouldn't be doing it, full stop. If we have to, and this is only, again, if we absolutely have to, if it's going to be informing programming responses or policy responses that are necessary to provide immediate and important supports for communities, then and only then is it appropriate for us to do face-to-face data collection. So wherever possible, obviously, use secondary data sources, and only if it's critical, and of course ensure that there is appropriate measures are taken to protect those who are collecting the data and those who are they're collecting the data from. And in all of this, and all this kind of concern around kind of keeping distances, etc., we really do need to still be thinking about maintaining data privacy and security standards. And this is probably the one that comes up the most in my work. Fortunately, here we go. The one that comes up most in my work actually is around remote data collection, so online and phone-based. And one of the things that I'm finding is that people aren't acknowledging as much as they should be that there's a potential to traumatize or re-traumatize people. The reality is that there's a lot of kind of side effects of COVID and the lockdown itself, including the loss of family members, being the lack of privacy, we're seeing increases in violence, etc. And so we need to kind of consider when we're asking and posing questions over the phone or online, the sensitivity of these questions, and should we be actually collecting this data? Is it absolutely critical? And one of the key issues here is we should be avoiding sensitive questions. Also, we should be considering when we're actually posing questions, and they could be kind of questions related to whether or not there's, people are experiencing vitamin A deficiency, and issues around intestinal worms, etc. And we're asking physical questions, but the reality is that, is it appropriate to be asking these questions? And if we can't provide the services, if we can't provide vitamin A supplements, deworming tablets, etc. So these are the types of issues we need to be thinking about. What is the point of asking questions if we can't actually then subsequently provide services? So again, kind of being thoughtful about the types of questions that we're asking. Also, one of the things that we have frequently is around when we're doing online, who's actually going to be missing out, who won't have access to kind of to a computer, who won't be doing online surveys, and what are the implications? Because obviously some of the most marginalized communities are those who don't necessarily have access or good access to the internet or to phones. Obviously thinking about the privacy and security standards on the platforms that you're using, but also about informed consent. One of the issues that keeps coming up is that we are repurposing databases with phone numbers for programming or other purposes. Is it appropriate? And the only reason it can be appropriate is if there is informed consent for it. So the assumption that we have this data and that we can then approach these people needs to be checked by appropriate informed consent processes. So I'll leave it at that. And if you have any questions for me afterwards, that's absolutely fine. I just wanted to note a few references that we've got around nutrition and COVID, but also some around ethics. But also in the question time, there's both myself who can respond to questions around ethics, but also my colleague from the nutrition section, Jo Jewell, who will also be available to answer specifically technical questions. Okay, thanks, Richard.
That was brilliant, Gabrielle. Thank you very much indeed. And you got us off to a great start with some tough questions to reflect upon. Let me now go to Khadija Mittu from the University of Chittagong in Bangladesh. Khadija, over to you.
Thank you. So I'm sharing my screen now. Hello, everyone. I'm going to present from my ongoing research project that I'm working on. And as a qualitative researcher, I'm working in a mixed method research project, and then we are conducting a virtual qualitative research round one. And then today I'm trying to present some challenges and emerging lessons that we are having. And as the project is still ongoing, this is more like a learning experience for all of us, and I want to share that with all of you. So I want to tell you about the project, the research project that I'm involved in. It's a longitudinal research program for 9 years. It's gender and adolescent global evidence, and we're working in 6 countries, including Palestine, so 7 countries actually. And we are focusing on different capability areas of adolescent boys and girls, and we're also talking to their parents and community leaders and community members. And part of that research, we have conducted some baseline research already, and now in the COVID context, we are conducting some mixed method virtual research. Part of that research, we are working I don't know where did that box go. Anyway, so part of that research, we are conducting some surveys and qualitative interviews over phone in different countries. And today I'm only talking my experience from Bangladesh, where we are doing 5,000 surveys. The quantitative team, by the quantitative team and by the qualitative teams, we are doing virtual in-depth interviews with 30 adolescents in Dhaka and 30 adolescents in Rohingya refugees in Cox's Bazar. Let's see. Okay, so in this study, we are really aware of being cautious that the virtual interviews or the phone-based interviews are not substitute of face-to-face qualitative data collection. They can generate very rich data in extraordinary circumstances like COVID that we are in now. In different countries, we use different platforms like mobile phones, WhatsApp, online platforms, depending on context. In the Rohingya context, particularly, we use mobile phones for interviews, and all the ethical considerations remain unchanged that we use for our baseline research. However, we face some very specific challenges in Rohingya context, particularly that I'm talking. So we face very poor telephone network because in the camp areas, the government has reduced the phone network and they banned internet connection for security reason. And Rohingya population is really vulnerable and marginal, and they did not receive refugee status in Bangladesh. They are still considered as forcibly displaced Myanmar nationals. On the other hand, they are not Myanmar citizens, so they're basically stateless people. So they live in a very constrained situation. And in this particular context where people are maintaining social distance, the poor mobile network and internet banning is putting them even in vulnerable position. And while we tried to conduct those research, those interviews over phone, it was way more challenging than we expected. And we couldn't reach people, and after several attempts, and the phone calls were dropped, and then we had to call them again and again in different intervals, and then it was really challenging. Then the other challenge was that finding the right person, because since we were interviewing, we were selecting people from our baseline research, so we already had developed a database with all the information and the contact numbers and household information and everything. So we were trying to reach those particular people. So in our previous round, we interviewed 149 people. So we were reaching 30 out of them, only the older adolescents, boys and girls. So when our researchers called them, some other person said, okay, I am so-and-so, you can talk to me. So it was really difficult to know if he or she is the right person. And then we had to do a lot of cross-check to get to the right person. And then we found that in our database, we had several phone numbers listed under one person, because not many people, like especially adolescents, our respondents, have their own phone. So sometimes they gave a phone number of their parents, of their relatives, and sometimes their neighbors. So we had to attempt several times to reach the right person. And then we realized that rapport building was more challenging than over phone than face-to-face. And then many adolescents were not talking, willing to talk when we called. And then the ethical part was really alarming for us, because as we found that girls do not have phones, some adolescent boys do own their phones, but none of the girls were having their own phones. So we had to reach the parents, and then we had to make sure that that girl can talk over phone that is not owned by her, and then still we can ensure privacy. It was even more challenging when we were trying to talk to married adolescent girls, because we were calling on their husband's phone. And then it was, for many cases, we realized that the data was compromised in that way, because the husband's presence didn't allow the girls to talk freely. So we had to come up with different strategies to mitigate that. And the other challenge that we found is that when the researchers called, many respondents thought that that call is from an aid agency or an NGO who are working with them. So that was another challenge for us. So the lessons we learned, despite all the challenges, is that it was very important for us to build an existing relationship, because when the researchers tried to tell them that we came to you 3 months ago or 4 months ago, we did this interview, and then when the participants recognized that person, then they were more comfortable talking to the researcher. And then they had to, the researchers had to start with many different informal conversations and tried really hard to build the trust among themselves, like between them. And then when we were trying to ensure privacy, we had to come up with multidimensional approach. We tried to interview the married girls in different intervals, like different segments. We call them at different times when they can ensure privacy, and we requested them to walk a little farther than someone if they can do. And then also we did like several phone calls. The connectivity challenges require planning and flexibility for us, because the researchers tried many times and then the phones were unreachable, but they tried at different intervals and different days so that they can make sure that they can reach that person or not. In some cases where we could not reach at all, we had to replace that particular respondent with someone else from our database. And then I already talked about the different segments that we did, and then we also had to do some backup interviews in cases of compromised ones, because we realized that few interviews we cannot really consider as not compromised, because the researchers realized that the husbands were present. So 2 interviews we had to sort of disregard to include in our research. And then we tried to keep, we found that the open-ended questions and the complementary conversations really helped, because over phone, it was difficult for the adolescents to feel comfortable communicating with the researchers. So the researchers tried innovative ways to build rapport with them. So that was really helpful for us. And so I want to finish it quick. So one thing I want to tell here is that at this context where we are now, we don't know when we'll be able to do our face-to-face, person-to-person qualitative research, but we really think the qualitative research is really important. But then in our research, we think that we are having some emerging lessons that we can use, and I think this research can help, and this kind of findings and lessons can help others who are trying to conduct qualitative research virtually. And then we saw that the qualitative interviews questions should be, like, the breadth should be limited, and we cannot ask everything over phone. And then we planned for follow-up interviews, and then we backed up for compromised data. And one thing we found that the working with community facilitators and the community leaders were really helpful. So we conducted some key informant interviews, and then we sought their help to reach the adolescents and sort of
okay, Khadija,
amongst them. So I have this, yeah, so I'm just wrapping in 30 seconds. So we think that we learned that our research should be more on, like, dissemination should be quick and real time, and we should be considering the digital divides that we experienced in our research. And then we thought that the ongoing analysis and debriefing constantly is very helpful. Thank you.
Okay, thanks very much, Khadija. Let's go straight on to Sarah, and if everybody could try and keep to their 5 minutes if they can, please. So, Sarah, over to you.
Good morning or afternoon, everyone, depending on where you're dialing in from. I'm the founder and CEO of a company called Grow Intelligence, and I'll tell you just a little bit about it just to make sure you have a little bit of context. We're a data analytics company. We're an AI company that's focused on harnessing large disparate data sets that have anything to do with global food and agricultural markets. We have developed a language that can ingest really data in any format or any language and make sense of it. So connect the dots across the data sets to create one continuous data stream, to reconcile differences in reported data sets by looking at multiple sources of data, but also looking at agriculture as a complex real world system, which means that we're looking at data that ranges from data about our earth and environment and climate, all the way to connecting it to markets, which is much more not just about prices, but really about demand, which is means that we're looking at data that has to do with demographics and socioeconomic data, etc. So we, as an organization, are not really an organization that is a primary data collector, but what we do is really think of how do we make information about food and food security significantly more accessible and discoverable. And then the second is, how do we add a layer of intelligence on that data so that it's not even just about discovery, which is, you know, knowing what you want to ask, but also helping people ask the right questions. And so I think in the context of COVID-19 and food security, there's, you know, there are a lot of questions that have been asked, a lot of questions that have emerged around food security, and you know, it's obviously happening at a time when primary data collection is very difficult. And so, you know, we've spent a lot of time thinking about how do we fill the gaps that we have in data if we're not actively out there collecting it. So can we create new data from existing data sets? And then how can we make use of alternative forms of data to create new data? So, you know, I think this is something that has really become important in this context, largely because you know, COVID-19 is impacting us as a world, meaning no country has been protected from it. But as you know, data about, you know, every country in the world is not equally recorded. And so public institutions in places like the United States have way more publicly available, but way more structured information than, say, understanding food security in sub-Saharan Africa. And so we've spent a lot of time creating new data during this time, and that's really by leveraging existing data. So to give an example, it's, you know, while COVID-19 itself has presented food security challenges, there are other market driving events that are making food security even a bigger issue. So for example, locusts in East Africa and locust plagues in Southern Asia have presented much bigger challenges to food security than planned. And so that meant that thinking about how can we better inform governments and create models using a combination of known techniques and satellite imagery, plus historical data that we have, to come up with models that say, we think these are the areas that are being damaged and impacted, given that on the ground deployment for ground truthing is significantly harder. So can we really target resources and say, we think these are the most impacted areas, this is the severity of impact, and then help governments mobilize limited resources to go ground truth in those areas versus trying to deploy across a country where that becomes incredibly difficult. You know, the other types of data that has been really, really important to track is actually as policies have shifted on food security, for example, and they really have on the fly, because food security is national security. One of the things that we've seen in COVID-19 is a lot of countries adjust trade policies or implement temporary trade bans in the context of COVID-19. And so we saw this happening with rice in Southeast Asia. We saw this happening in wheat in Eastern Europe with Russia and Ukraine. And this was all just driven by the fact that the domestic currencies being under so much pressure meant that the local price of food was soaring, but also hyperinflation became a key risk. And so one of the things that we jumped on very quickly was to say, well, these are truly COVID-related policies, but what people were not doing, and what was becoming very difficult, was connecting the dots of how do I, as Kenya or Ethiopia, or as a net importer of grain, how am I going to now be impacted by policies that are being implemented in places that are very far away from me? And how does that present a short-term threat or a medium-term threat or long-term threat to my domestic food security? So really kind of mapping, again, global actions back to domestic circumstances and trying to really prototype and build out domestic food balance sheets, because that's ultimately what we need to then start to kind of drive policy in the right direction. Meaning, you know, maybe we shouldn't be implementing bans on exports of wheat because there's an excess supply of wheat globally. It's a question of distribution. So now do we tackle the distribution problem? So really kind of trying to shape conversation and policy towards the right places, because again, with food security being national security, we've seen a lot of countries jump on what's, I guess, what intuitively feels the like the best thing to do, which is you know, close everything off and protect domestic markets. And so there's really I think it's a time where we have to be very creative about how we use publicly accessible data that has historically not been easy to use because it comes in a different language or in a different format, etc., and to connect those dots to create new forms of data. So with that, I'll close my remarks.
That's great. Thanks so much, Sarah. And I can see that the questions are coming in, which is fantastic, and some great questions following up on the presentation so far. But before we get to the Q&A session, I'd like to introduce Patrick Webb from Tufts. Patrick, over to you.
Thank you, Richard. Wonderful to see so many great people from all over the world who are joining this. My name is Patrick Webb. I am a professor at Tufts University and also technical advisor to the Global Panel on Agriculture and Food Systems for Nutrition. I am presenting just a little bit about a policy brief that the Global Panel has just put out a couple of days ago relating to food systems in the context of the pandemic. You can access it at the website here, and it's very much focused on the short-term and longer-term importance of not just protecting consumption today, but enhancing that consumption and ensuring greater resilience of food systems and food value chains in future, right? So seizing this as an opportunity. But I'm also a researcher who's done a lot of research both on and in crises, and I think I'd love to engage in the Q&A on experiences relating to experiences that go back to the Ethiopia famine of the 1980s, through the Southern Africa drought crisis of the 90s, all the way to Ebola in Sierra Leone, and then and now this. But first, just a very few slides, really building on that Global Panel policy brief to raise a couple of issues that I think are important for us to at least take into account. So the pandemic, we know, is a global, obviously, pandemic, and there is a real concern about how little we know about what's going on, particularly in low and middle income countries. And what we do have are updates from quite a number of low and middle income countries, and we need to be paying attention to these numbers. But my point here is, are these data points 100% accurate? The answer, of course, is no. Are they representative of the entire population or distribution of need in these countries? And the answer, again, has to be no. And are they replicable, which really matters for science questions? And the answer, again, is no. But that doesn't mean that the large data that we're using to compile these kinds of graphics are unimportant. They're not. They present us with three majorly important pieces of information: order of magnitude, direction of travel, and relative status. And all of these really matter, globally as well as nationally and subnationally, where you have that granularity, to informing choice of response. And I think it's really important that we keep some attention to what governments or what other stakeholders do or don't do in the context of crisis, which is actually largely what determines the severity of the impact, right? So I won't elaborate more on that. There's a lot of concern about food system impacts, and it's good that people are taking a food system lens during this pandemic. It's not just an issue of food supply. Of course, it's not just an issue of constrained access by consumers. All the way along every value chain, a lot of different segments of value chains and the different pathways by which food moves from farm to fork are being impacted. And what this graphic shows is the importance of the informal economy, right? So very smallholder, traders, food processors, transporters, and so on, are being seriously affected in many parts of the world, but particularly in lower and lower middle income countries. So we really need to be paying attention to what their roles are, have been in the past, and how they're being impacted in the context of this crisis in maintaining food system integrity. And of course, in all of this, it's not just calories we're concerned about, it's the diversity, the quality, and the safety of foods that are moving along value chains that need to be taken into account. Some surveys have looked at small and medium enterprises, the small businesses that are really very, very important between government and household or farm. And none of these impacts that have been reported to gain are unexpected. Dropping sales and difficulty maintaining financial liquidity and paying staff and so on. All of these would be applicable in the US or the UK, as well as in Nigeria or Nepal. But it does bring a focus to bear on SMEs as key players in the food system. And any solution, both short-term and long-term, needs to take these into account. Last slide. The World Bank and ILO have been recently updating their estimates. Pre-COVID, the trend line decline in extreme poverty, that's less than $1.90 a day, was expected to continue on a downward trend. Back in April, which seems like a lifetime ago, there was an estimate that there would be an uptick back to 650 million. Now we have a June re-estimate, which sees a best case scenario of extreme poverty rising to somewhere between around 675 million, or a worst case scenario, which sees it rising significantly above 700 million, which in a sense means over 100 million additional people thrust into poverty. That, of course, is a major concern, both for the consumer side and the production side. So, but finally, let me throw out then, if I may, a couple of key questions that relate to all of these dimensions. And I'm trying to focus here on the distinction between operational needs, which are crucial and paramount, trying to understand what people need and how to deliver it to them, are not always the same as science needs, which actually are intended, though, to document what works, to be able to better inform the humanitarian response in subsequent periods. Right? So we need to understand when we're the issues of informed consent, the issues of secondary data versus primary data, all of these need to be kept in mind when thinking about science needs, and I've used the word versus operational needs. I would argue that science needs to inform effective operations and vice versa. The second point, who is most affected and why, the distributional effects, means we really need to pay much more attention to what is representative and what are the ethics of research during crises or versus about or on crises, which often means after crises, in which case one is often, and I'm thinking back to the Ethiopia famine of the 80s, the people with whom I interacted on the ground across the country in around 85, 86 were, and sadly, the survivors. I was unable to interview those who died, and that actually really framed my thinking about, well, you're only talking to a subgroup of people. What do we take away from this? Third, how much information is accurate? What is the importance of accuracy? Spurious precision, but when is enough enough, and how much what kinds of accuracy are needed to inform operational response versus science? And then finally, do no harm with imperfect knowledge. Do no harm has to remain paramount in any intervention, as well as any kinds of science that involves traumatized populations. But at the same time, I would like to just put on the table that do no harm has to focus a lot more than it has on the policy and programmatic choices of first responders and second and third responders. With imperfect knowledge, a lot of assumptions are made, a lot of assumptions are wrong, and a lot of resources can be wasted, which can impair recovery or subsequent actions. And so we need to be paying a lot more attention to imperfect knowledge in the context of an overriding principle of do no harm, which isn't just about harming individuals, it's about harming economies, it's about harming the ability for policies to make a difference over time. I'll stop there. Thank you, Richard.
Okay, thank you very much indeed, Patrick. Okay, we've got 4 fantastic presentations to think about, and I love the questions that are coming in. I'm going to just start off, if I may, with a question myself to all of the panelists, and actually I'm going to ask a new presenter to come in perhaps first, and that's Joe, who's Joe, perhaps you could introduce yourself as well. You're from UNICEF and work with Gabrielle, I believe. And the question really is, this is a discussion about the intersection of COVID-19 with agriculture, nutrition and health. And I wondered, what new questions should we now be asking? Patrick finished his presentation with some excellent questions. Joe, what new questions do you think we should be asking when we're thinking about the intersection of COVID-19 with agriculture, nutrition and health? Over to you.
Thanks very much, Richard. And yeah, just to introduce myself, my name is Joe Jewell. I'm working in the nutrition section of UNICEF, so a colleague of Gabrielle's, but working in a different part of the organisation. And I think that's a really interesting question, of course, because we're right in it now, in the response, trying to work out what is the impact of COVID-19 on nutrition, and what does the UNICEF's response need to look like as it becomes a more protracted issue. And of course, the 3 things that we need to be considering is around what is the impact and what does our response need to look like in terms of guaranteeing children's access to nutritious diets. How do we maintain or adapt to ensure access to essential nutrition services, and how do we make sure that there's no sort of long-term lasting impact on the dietary practices of children and caregivers. And of course, the longer this goes on, this is a critical period for children's nutrition, both infant and young children, but also adolescents. These are not short time periods we're talking about, and it's likely to have a long impact. And I think one of the things, this discussion here is a really interesting intersection around programming, but also knowledge generation to continuously refine and improve our programming right now. But also, I think, as you've alluded to, what are the adaptations and innovations that actually demonstrate utility now that we would want to continue in the future. So I think some of the things that have been discussed here around, what are the opportunities from digital solutions to data collection, what can we do to actually collect information online, and actually that's something that probably could continue in the future. How do we actually reach targeted communities with interventions online as well, such as breastfeeding counselling, complementary feeding counselling. what are the things that can be shifted from health facilities to community? So it's not my area of expertise, but you know, when it comes to the treatment of acute malnutrition, for example, are there innovations that we can do there? What can we learn around people's lived experience of the COVID-19 pandemic, and what is that? What are the insights for now, but also the future in terms of how systems, multiple systems, food, social protection, health systems are or are not working for communities that are in need. And also, I think, you know, the last point would also be around what are the changes that were already on the horizon before COVID-19 that have perhaps been accelerated by the COVID-19 pandemic. And maybe this is not applicable to all contexts, but certainly in middle and upper income countries, we saw a shift, for example, to online food delivery purchasing. That's probably been accelerated now, and what's the impact of that for dietary practices and also policy solutions? I'll stop there.
Thanks very much, Joe. I particularly like your point about lived experience, which we don't get enough of. And of course, Khadija was referring to the qualitative side of this, which is important, and which journals like mine tend to not do as much of, unfortunately. Let me turn to Patrick then. Let's go in reverse order. Patrick, new questions briefly. You touched on some existing questions, but some particularly new ones.
Sure, Richard. I mean, I think I like to focus in this. There's so many, and I'd like to focus my attention on that interface between science and practice, which I think is so important. And again, I would reiterate that I feel that science really has to be better informing practice, both policy and programmatic, and vice versa. I think programmatic needs need to be better informing the questions that science asks, and how they ask it, and what they're asking. So a large part of me feels that we need to be paying so much more attention to things like cost effectiveness of interventions. Not simply did we save a life, but did we save a life, or did we prevent a case of wasting, or did we put a lid on the expansion of a disease, not just effectively, but cost effectively. And how can that then be compared to alternatives that might have been entertained for achieving that same effect? So I think the cost effectiveness of actions taken or not taken matters immensely, including at the national level or the policy level, or even the multinational donor level. What are the costs and benefits of placing, like the World Bank, $12 billion in response to COVID for debt relief and supporting low and middle income country responses? Okay, where's that coming from? Where's that 12 million suddenly materializing from? And what else is not being done that could impair, again, recovery and long-term growth in the longer run? The second question I would pose, and it's totally related to, it's partly the do no harm, but it's related to the cost effectiveness, is we need much more on the so-called what works question, which the Lancet has been very important in championing. What works in the context of crises still remains poorly researched, I would argue. And, the rush, for example, in most crises, the rush to prepare for an increase in child wasting, let's say, which typically means, and I'm not fingering Joe or Gabrielle, who I respect immensely in the work of UNICEF, but the rush to assume that wasting is going to be the #1 problem involves millions of dollars allocated to a certain kind of response that may or may not be appropriate. And so I think the assumption that we know what effect on health or nutrition a crisis is going to have is driving a lot of our actions, and we need to be a little more self-critical and evidence-based on that.
Okay, I really want to come to the audience questions, but I'm going to give Sarah, Khadija, and Gabrielle, if you'd like, new questions that we should be asking, just very, very quickly. Sarah?
Okay, sorry, I was having issues with my mute button a little earlier. So I think in terms of, you know, new questions we should be asking is, you know, I still think that there's a lot of room for creativity in doing more with less. And so to me, it's about that, which is we're going to live in a resource constrained world for some time. And so what are the tools that we have that we can, you know, we can essentially do more with less with? I don't think that's going to change anytime soon. So.
No, that's good. That's good. Thank you. Khadija, very quickly, new questions from your perspective.
Yeah, just everything is so important here. Just to add that, I find that what we are doing is that very small scale, just to check how it's working at this point. But since it's, you know, not getting away soon, we have to really think of redesigning our research thinking and then see how we can make it more effective, you know, for evidence-based, and then see we can you know, sort of think through our research in a different angle in this particular context. So that's all.
Thank you. And Gabrielle, did you want to add anything?
I think mainly for me, it's about doing the evaluations of what we're doing. If there's any way to actually looking at our programmatic responses and then evaluating our programmatic responses, including funding options, etc. So I think for me, it's mainly let's just keep doing the evaluations rather than just implementing the programs, but also to support what Joe mentioned. I think these are kind of critical issues that we really do need to look into.
Okay, that's wonderful. Now we've got so many great questions that have been posed to you all. So I'm going to have to be very selective and try and choose the questions that raise some of the biggest challenges. So one question that was raised was very direct about the existential crisis that we feel that we're in currently. And this is an existential crisis not only for science as posed in the question, but also for our societies, for many of our societies. How do we move forward? How do we move forward in this era now where we're going to have to peacefully coexist with this virus? And there's not going to be a possibility to return to life as it was anytime soon. And we can't all live in lockdown forever. So how do we move ahead? Who'd like to take that? Maybe I'm going to start with Gabrielle, actually, because this is the ultimate ethical question, isn't it, Gabrielle?
I suppose for me, in terms of, and particularly around data and looking at information, I think there's, you know, someone mentioned in the comments, and I thought it was just perfectly framed, we should be measuring less and we should be considering the quality of the evidence that we're producing. And I think we need to understand what's happening in the world around us, but we should be doing less rather than more. And what I'm finding, and particularly it's something that I think it's quite universal, is that I'm constantly being called in to kind of work with various projects, but everyone wants to be doing everything now. And they're all competing, and there's a plethora of kind of research projects happening all over the world, and people aren't thinking, they're just collecting the data. And I think for me, it is this issue of being really clear, what are the research questions? Have they been done? You know, who is doing this work? Is it already in place? And given kind of our methods are going to have to change, and the fact is that our methods have changed, and I think there is going to be this shift around the way we do collect data. I think we really need to think about what we can capture. And that's a big issue for me, because frequently people say, oh, we want to capture this, but they're actually not collecting the right data for it. So collecting the right data and what is absolutely needed for us to understand this new and emerging world, rather than just going out and everyone saying, well, I've got to get 10 publications now, or we've got to produce more information. So figure out what is actually needed, what is being done, and make sure it's useful.
Yeah, absolutely. Khadija, how do we move forward?
So for me, in my particular research, what we were trying to do is that we had already conducted our baseline and we were moving to our next phase, from July, but that was stopped. But then since it's a humanitarian situation and that, people living there are living on humanitarian aids and the services and all the aids are going to them, and then some services were cut down, some services were being continued. So we really felt it's necessary to know what's going on in the field, like what's going on with their lives. And we know in our research, the adolescents' voices are totally ignored in research. And even in our COVID virtual research, we found that the services and the information provision and all the awareness programs were not designed gender and age disaggregated way. So when we talked to the key informants who were running the awareness programs, the prevention programs, they said that we didn't design anything for adolescents or for children. All the schools are closed, the learning centers, they call them. And these children, we are interviewing the adolescents, so they are sort of not doing anything. They don't receive any information. They're not going to school. They're not doing anything. They're in a limbo. And then we found that when we talk to them, even sharing their experiences with someone did help them. And then we thought that our research, our finding is not like adding something or jumping into another research project. It was the continuation of our longitudinal research, and then the publishing those research in real time was really helpful. And then we think that can help program designers and the practitioners
Very good.
to sort of redesign their work.
Thank you. Sarah, how do you see us moving forward in beyond this particular crisis? What's your vision for the next 6 to 12 months? What are you going to be doing at Grow Intelligence?
Oh gosh, I think that the crisis is going to be with us for a lot longer than the next 6 to 12 months, unfortunately. So, so that, and that's why I said, it's about how do we do more with less, because we'll be setting, in many ways, new normals, right? I think everybody initially was very much focused on crisis response, meaning, you get hit by something and it exposed, I think on the food security front, it exposed the weaknesses we've had in our supply chains for a very long time. And, I think one of the biggest challenges we'll have to address, and this is not a 6 to 12 month problem, but we do have to start thinking about it now, which is, we designed supply chains on the notion that we wanted to make food as cheap as possible. So we got cheap by economies of scale. And that meant concentrated production, concentrated trade flows. So concentration allowed us to make things cheap. And so that's, that's in the underlying production of the product, but also the processed good, right? That we're consuming. So whatever that value add we added to raw products. So one of the big things that will emerge out of this, and I think we need to start thinking about, is we will have more distributed supply chains. That will probably mean that food companies will rethink where manufacturing occurs for what market. How does that start to impact cost? And then what is it that we need to do to be able to make sure that some of the gains that we've gotten in terms of price and affordability don't get lost in that sort of mix where we now say, okay, we don't like the exposure that we've seen. We don't like the volatility and the weakness that we've seen in the supply chain, but a distributed supply chain will mean a lot of upfront investment. And so how do we de-risk that investment? And how, to me, it's what does the research community know about, on the demand side, as I said, for me, the demand side is about people. It's about culture. It's about a lot of things that are much softer, but are really important components to feed into these models. And so I think, you know, for us as a company, that's definitely something we're thinking about now, which is, what does a distributed supply chain world look like? But most importantly, what is the implication to the price and affordability of food globally? And I think that will have some pretty big consequences.
Yeah, I mean, in this concept in health that's grown in the last 5 years or so of resilient health systems, and trying to define what resilient means, that's suddenly come to the fore like never before. And actually, we're spectacularly badly prepared to answer that question of what is a resilient health system, because we've had 40 years of neoliberalism, excuse the political comment, which has kind of destroyed the notion of resilience. And as wonderful as the market might be, and as wonderful the ideology of reducing the state as much as possible might be, the fact is that it's left us very, very precariously prepared to deal with a situation like this. So how do we, you know, what I suppose my question to the panel then would be, well, what does a resilient food system look like? Since I can't answer that for health, I'm suspecting you might be challenged to answer that for food, but it's a question that we need to be addressing, I think. So, I mean, Patrick, let me throw that to you. What's a resilient food system?
It's not one that is based entirely on self-sufficiency. Right? And so I think one of the quick and early lessons of this pandemic has been the importance, yes, of bolstering and nurturing local segments of food systems and accessibility. But at the same time, food will always need to move from A to B, and not just within local food sheds, if you like, but also across between neighbors and neighboring countries. And so food trade will remain an important component to ensuring that everyone has access to food. Singapore is one of the most food secure countries in the world, and it doesn't grow a whole lot of food, right? So that's obvious. That said, I think, yeah, I agree. There is now a huge emphasis on better understanding and acting on improving the resilience of all food systems, which includes to climate shocks and climate change, right? It's not just the income shocks and others. We need to, I think, seize this opportunity, not let it go, as we basically did in the 2007-2008 food price crisis period. You know, everyone ran around waving their hands and throwing money at the problem, but ended up doing largely this, you know, the same old. I think one of the major things we have to do different this time around is do different. We have to ask different questions. We have to hold people's feet to the fire. What are we going to do that's different in science and policy now to ensure, well, not ensure, to hopefully move us towards greater resilience of food systems, and document how we're doing it, disseminate good, credible information, and cost it.
Yeah. Joe, perhaps I could turn to you on this question. From your perspective in nutrition at UNICEF, you must have done a lot of thinking about this question of resilience.
Yeah, and actually, I mean, funnily enough, from my own personal role within UNICEF, the previous question and this question now are somehow linked, because, you know, I actually work on, normally, I work on overweight and obesity prevention, which is quite an interesting angle in this conversation, especially given how widely prevalent, you know, how global the pandemic has been, and it's affected many regions where overweight and obesity are the main, if not, you know, the only form of malnutrition that is sort of dominating the issue. And so we've also had to think about how systems work under emergency contexts to deliver healthy diets to the populations as well. You know, Latin America would be an example. I'm not saying that overweight and obesity is the only malnutrition issue that Latin America faces, but for a large proportion of the population, obesity is a major issue, and you have real issues in ensuring that actually the population has access to affordable and healthy foods at the right time. And, you know, when it comes to, distribution of foods, making sure that the distribution of foods is actually meeting certain nutritional quality standards is not an easy task in the context of a very processed food system that we have. And, you know, prior to the COVID-19 pandemic, UNICEF had started working a little bit more on food systems. You know, it's not necessarily our traditional area of work, but we recognize that food systems are essential for good nutrition, and they need to deliver for children and adolescents. And you need to think about, what's the supply chain actions that can be done, but also what are the food environment policies that need to be put in place to make, bring this supply-demand interaction together to make sure it delivers, healthy and sustainable and affordable diets for people as they need it. And one of the challenges for me moving forward, and maybe I'm diverting the conversation, is the overweight and obesity issue has not gone away, but priorities have shifted, and we've fallen back to potentially what are considered essential nutrition actions, even when overweight and obesity is really important. The COVID-19 pandemic has highlighted as well the risks of having a population that is heavily affected by overweight and obesity. So how, moving forward, are we actually going to address all forms of malnutrition effectively through the right combination of interventions and policies in a context of less resources, as Sarah says, less bandwidth? And I think that's the real challenge for how do we actually make sure that people can juggle 100 balls when they only feel comfortable juggling 10.
Very good. Okay, thank you. Now we have to finish in 5 or 6 minutes, so I'm going to have to wrap up. And I'm going to wrap up in this way. I want to give each of you 1 minute to say something to our 192 participants that's going to make them go away and think. So I'm going to start in the way we began with Gabrielle. What's your parting message to our participants? What do you want to leave them with?
I think it's one thing I could leave people with, and it's the same thing I'd say to my colleagues at UNICEF. When you think about data collection and research, what is it going to contribute? How is it going to serve the populations that you are working with or working for, or that are captured, that you want to capture? So for me, it's think of the value of the work that you're doing. And is it worthwhile? Has it been done before? And if you can then answer yes, if it is to be of service, then it's worthwhile doing.
Very good. Thank you very much indeed. Khadija.
Hi, I will add with Gabrielle, because what she said, it's very important. As a researcher, what I see here, particularly in this presentation, the take-away message would be that we should think about our research design, and then the evidence base and the experiences we are having as a researchers around the world. We can learn from each other so that we can better design and better practice our research in this particular context.
Great, thank you very much. Sarah.
So I think for me, I'll go back to the question you asked, which is what's a resilient food system? And it's something I've spent time thinking about, but it's really, I think the challenge that's upon us is, I summarize it in 4 words. It's availability, affordability, stability, and quality of food. Those 4 are kind of the main things that we're optimizing for. And, they're in constant conflict often. And so it's how do you balance these 4 components out, and how do we start thinking about it? But to me, it's if we think about them in those categories, then we touch on everything from nutrition to price to, kind of all those components. And then, stability comes, climate change comes in the stability component. So it's, I think it will touch on everything, but that's really where I leave.
That's great. No, that gives us a very nice roadmap thinking about resilience. Comes close to the notion of a right to a food system. Actually, in health we talk about AAAQ, which is the availability, accessibility, and quality, and so on around the right to a health system. Patrick, though, final parting comment.
Patrick, though, I would say we need to do better to give voice to those most affected. That requires us to invest significantly more than we're doing in capacity building for rigorous science and research capabilities in the countries around the world who are most affected, both by the climate crisis, but also by these many other kinds of shocks. Yeah, we're better than we were, but that capacity building agenda to drive a science agenda around these key questions and inform the ethical dialogue, I think we're weak on that, and we need to do so much better to give a voice to those most affected.
That's a great message. Thank you very much. And Joe, would you like to give a final thought?
Sure. I mean, I think it's been really interesting listening to it, and what Patrick has been saying has really resonated with me as well. So I think one of the things that UNICEF is attempting to do is to constantly check our assumptions as we're working, and also integrate the ongoing learnings into practice and make sure that that's shared across countries. But I think we shouldn't be afraid to actually capitalize on the opportunity to innovate where we see opportunities, and make sure that that is beneficial and continues afterwards, because I think that there are some opportunities that this disruption potentially presents in terms of working together with systems that don't normally function together, or doing something slightly different.
Thank you very much indeed. Well, I'd like to thank the panel for doing an absolutely fabulous job, and I'd like to thank all of the participants who've joined the panel to hear you and to pose their questions. I'm obviously sorry we couldn't get to every question, but it's been a great discussion. The last point I would like to leave you with is to remember, if I use a medical metaphor, that COVID-19 is an acute on chronic emergency. That's to say, yes, it's an acute emergency and we have to deal with it, but it's an acute emergency that's arrived on top of a series of chronic afflictions that our planet faces. And as much as we must focus on addressing COVID-19, we mustn't allow ourselves to be diverted from those chronic afflictions. Because if we suddenly wake up and we've got a vaccine, or we've eliminated the virus from our communities, but we haven't addressed these chronic afflictions that we face, then we're going to be in a very bad place when we eventually come through this pandemic. And somehow we mustn't treat COVID-19 as a zero-sum game, because humanity is not zero-sum. So with that, I'd like to say thank you, thanks to the organizers, and back to whoever. Sylvia?
Thank you, Richard.
Thanks, Richard.
So
thank you so much, everyone. On to the thematic sessions. I'm going to close the Zoom meeting now. Have a good rest of your day. Bye.
Right, thanks.